I'm honored to be here today with these great citizens and great Louisianians to ask that our state leaders move forward with the expansion of our Medicaid program. I do so based on two considerations. One, people. The number of folks who would have the opportunity to be able to benefit by having quality health care provided to them that they don't have right now. And the type of people that we're talking about. Our system right now has a safety net to account for those who are the poorest amongst us. But what we do not make provisions for are those folks who are attempting to try and advance and elevate themselves. This type of a program, this type of an initiative seeks to help those individuals who constitute, quote unquote, the working poor. Those folks out there who are not sitting idly by, who have taken the initiative, who have jobs, who are attempting to better themselves and to better their families, but happen to have incomes right now that unfortunately put them beyond qualification for a program like Medicaid. An initiative like this gives them the opportunity to be able to have access to high quality health care for themselves as well as for their families. Now, what else is my consideration in terms of being here today to support this effort as well? This institution that's right behind us, as Mike mentioned, the $15+ billion in additional funding that's available to the state of Louisiana gives us a greater likelihood of being able to see a great institution like this one that provides quality health care for Shreveporters and North Louisianans 365 days a year, to be in a position to have access to greater resources so that they can provide, first and foremost, high quality health care, but also continue to be a source of jobs and opportunity for so many of our citizens throughout this region. This is a hospital right now that's facing great challenges based upon some of the actions that have been taken in Baton Rouge, many of which, as mayor and as a citizen of this state, I do not agree with. But the bottom line of it is, what we have in place right now is the law of the land that applies to all of our 50 states. We've had other leaders who stepped forward who've taken advantage of this opportunity without consideration of ideological issues or aspirations. We're asking that our state step forward and do that as well. Act in the best interest of our citizens, act in the best interest of those mothers, those fathers, those children out there right now who find themselves in circumstances through no choice of their own where they do not have access to health care. What this opportunity provides is a chance for those folks to have the kind of coverage that I have a unique and deeper appreciation for right now. And so we hope that there will ultimately end up being a change of heart, a change of mind, and ultimately a change of direction with regard to this issue. And we'll see some movements and progress, and ultimately the acceptance and the understanding that this can, in fact, not just be good for Louisiana, it can be very good for our state.